Good evening. It's Thursday, March 18, 2021 here in Cebu City. I'm Cherry Ann Lim and this is SunStar Tonight. The Department of Health in Central Visayas has appealed to hospitals in the region to speed up their vaccination activities using the Sinovac COVID-19 vaccine. The region has yet to reach a 50% compliance in vaccinating all healthcare workers. Shari Coronel reports.
The Department of Health Central Visayas appealed to hospitals in the region to ramp up their vaccination activities for their healthcare workers using the Sinovac COVID-19 vaccine. This as the region has yet to reach 50% compliance 2 weeks after its vaccination program started on March 4. DOH Central Visayas spokesperson Dr. Mary Jean Duterte said only 13,843 healthcare workers have been inoculated with the first dose of the Sinovac vaccine. The region has been allocated 77,160 Sinovac doses, which can already cover 2 doses for 38,580 individuals. Duterte urged the hospitals to fast-track their vaccination. She added it is possible that hospitals might have been doing the vaccinations, but the submission of updated data are delayed. Based on the vaccination priority list, next to medical and health personnel are senior citizens aged 60 years old and above. Duterte added 232 healthcare workers have experienced adverse events following immunization. A total of 2,433 doses of AstraZeneca vaccines have already been availed as of March 17. A total of 30,000 doses of AstraZeneca vaccines arrived in the region last March 14. The DOH Central Visayas earlier said it will redistribute and use as first dose all the AstraZeneca vaccines that arrived in the region to make sure that these vaccines are administered before expiry on May 31 this year. Chari Coronel, SunStar Tonight.
Officials have clarified that the death of the healthcare worker who had been vaccinated against COVID-19 was caused by the virus itself and not the vaccine. Kenneth Torres reports.
The National Adverse Events Following Immunization Committee said that the healthcare worker who was reported to have died after getting vaccinated against COVID-19 may have contracted the coronavirus before inoculation. Dr. Romel Lobo said the healthcare worker's death was not caused by the vaccine. Lobo declined to say whether the vaccine came too late for the healthcare worker. The Department of Health said both the National and Regional Adverse Events Following Immunization Committees had concluded that the healthcare worker's death was caused by COVID-19 itself and not by the vaccine. Officials also did not specify the location of the healthcare worker nor the vaccine that was administered. Health authorities are currently administering Sinovac and AstraZeneca vaccines, the only vaccines that arrived in the country so far. Officials said the healthcare worker was administered the vaccine despite having comorbidities, namely diabetes, hypertension, and asthma. The healthcare worker was cleared for vaccination because these diseases were under control and there were no indications that would warrant deferment of the inoculation. A day after inoculation, the healthcare worker developed a non-productive cough, fever, and rashes. Upon consultation at the hospital's emergency room, the healthcare worker was advised for admission. However, allegedly refused and went home on quarantine. After 3 days, the healthcare worker was back in the hospital with worse symptoms and was admitted, swabbed, and confirmed to be a COVID-19 case. Officials said the disease progressed rapidly, resulting in the frontliner's death. Officials reminded the public to follow minimum health protocols even after vaccination. Kenneth Torres, SunStar Tonight.
President Rodrigo Duterte met with Cebu officials led by Governor Gwendolyn Garcia and Presidential Assistant for the Visayas Secretary Michael Dino in Malacañang Wednesday night. Chari Coronel reports.
Some Cebu officials had a dinner meeting with President Rodrigo Duterte in Malacañang Wednesday night. Governor Gwendolyn Garcia, together with Presidential Assistant for the Visayas Secretary Michael Dino, Mandawi City Mayor Jonas Cortez, Lapu-Lapu City Mayor Junar John, and Talisay City Mayor Samsam Golias were present during the meeting. Congressmen Johnny Salimbangon, Duke Frasco, and Emery Uwano Dizon also attended the meeting. In his Facebook page, Golias said he reported to the president the current situation of Talisay City. Likewise, Chan said in his Facebook page that he expressed his gratitude to Duterte and Senator Bongo on the projects of the administration for Lapu-Lapu City. The officials did not specify, though, what were the agenda in the meeting with the president. Last week, Cebu mayors allied with the ruling PDP Laban convened to support the move of the Metro Manila mayors, calling Duterte to run for the vice presidential seat on 2022 national and local elections. Chare Coronel, SunStar Tonight.
The World Health Organization has defined burnout as a syndrome resulting from chronic workplace stress. To give us tips on avoiding burnout, here's Tiffany Neri.
In a previous episode, we talked about the 4 stages of burnout, which is caused by a lot of things, mainly prolonged and excessive stress. Don't you worry though, there are still a lot of things we can do to prevent or recover from it. So here are 5 self-help tips to reduce your chances of getting burned out. Number 1, recognize what you're going through. The first step is to recognize the symptoms of burnout, that you're going through some sort of hurdle and want to get out of it. Number 2, reach out to people. Join a group with a cause that is meaningful to you. Reconnect with a friend. The feeling of helplessness is a lonely road. One of the natural ways to de-stress and snap out of it is some sort of social contact. Opening up to people can help you more than you realize. On that note, number 3, cut off or stay away from toxicity. It's important to recognize the toxic aspects of your life and reduce contact if you can't cut them off completely. Try as much as possible to limit the time you spend doing things that give you negative vibes or being with those kinds of negative people. And that is where detoxification begins. Number 4, reframe your outlook on work. We need money to survive and work to have money. Since work is unavoidable, try making deliberate steps towards improving your state of mind. How? Find value in your work by focusing on aspects of the job you do like lunch breaks with the office mates, and reminding yourself about what you can do to help other people. Number 5, find balance in your life. Oftentimes, burnout is caused by an imbalance. If you hate your job, find satisfaction and purpose in other aspects of your life, like friends, family, hobbies. Spend your free time doing something that brings you joy. Take time off when you need it. Set boundaries by learning to say no, and set aside time for relaxation and loads of sleep. There are so many things we can do and stop doing that'll help us slowly break free from that mind-numbing prison of burnout. But the most important way to overcome it is mindfulness. We have to be mindful about the things that cause us stress and stay mindful about how to manage them. Recognize, reach out, cut off, reframe, find balance. These 5 things can help you change your life if you let them. This is Tiffany Neri for Lifestyle on SunStar Tonight.
To get the latest, visit www.sunstar.com.ph. Follow us on our YouTube channel and official social media accounts on Twitter and Facebook. I'm Cherry Ann Lim, and this has been SunStar Tonight. See you again tomorrow. Good night.